Good morning, Year 9. My name is Claire Bowden. I'm head of the Business Care and Health faculty. This short presentation replaces the one that I would usually give in an assembly to you, where I'm going to talk about an option subject that you wouldn't have studied before, called Health and Social Care. It's a BTEC qualification, which is slightly different to a GCSE, graded slightly differently, and it's in a subject that you wouldn't have studied before. So it will be something new to you, not something that you've done in years 7, 8 and 9. I'll give a presentation and talk over in the background, and for any further information, my email address is listed at the end. Thank you for listening. As you can see, the qualification is called a BTEC Technical Award in Health and Social Care. It's looking at all of the areas that are on this slide. So it's about health, it's about care, it's about support, it's a little bit about learning about the NHS. But fundamentally, it's all about people. So if anybody's thinking of working in those fields, the NHS is one of the biggest employers currently in the UK, but in lots and lots and lots of different types of jobs. It's not simply doctors and nurses. The BTEC Health and Social Care is a technical award, and it's equivalent to the grade GCSE. It's graded grades 4 to 9. It's graded pass, merit, distinction, or distinction star. And there are 3 what are called components of work. 2 are coursework, and 1 is an externally assessed piece. That's an exam. So you do 2 pieces of coursework in year 10, and you do the exam in year 11. We do the exam in January of year 11, not the summer, and then finish off in upgrade coursework. What does it cover? If we're looking at health, we're talking about the body and the mind. We're talking about managing height, weight, looking at the diet that people eat and nutrition and the value. We're also looking at exercise. What types of exercise should people do? Should it be low impact, high impact? We're looking at managing well-being, looking at stress, looking at anxiety, and we look at people's health in general, the factors that have affected them, and come up with a health plan for individuals with different needs. We also look at how society affects us. So, for example, smoking, television, school, education, social media, news, what's going on around us in the world, current affairs. For example, at the moment, the COVID-19 pandemic, it would be an issue that's discussed in great detail. And then we look at care. So who looks after people who are ill? Is it family? Is it friends? Is it professionals and neighbours? Doctors, nurses, therapists, carers, paramedics, speech and language therapists, personal trainers. We look at the whole team that might surround a person if they're in need of short-term or long-term care. What you actually learn about, we look at a unit about human lifespan. So what rights do people have when they're being cared for? We look at the care values, so dignity, respect, kindness. We look at what needs people have. So how do people prioritise, particularly perhaps at the moment when finances are restricted? Are they financing sort of food, a mobile phone, smoking and cigarettes and alcohol? And we look at how people sort of plan their lives. We look at what's called the human lifespan, so development from birth until death, and all of the stages in between. So we look at physical, intellectual, emotional, social health and well-being. And we finish by looking at health promotion. What should you eat to stay well? What should you not do? How much exercise should you take? If you've started smoking, then we look at things like smoking cessation and trying to help people stop. And we look at long-term health promotion campaigns, and we decide whether or not they work. If you're studying BTEC Health and Social Care, it might lead you onto a number of different areas. So you can study at level 3 and come up to 6th form or go to college. That could then lead you on to university or apprenticeships and employment. And you might be thinking about going into the following careers that are on the slide. So the teachers, social workers, midwives, the doctors, the nurses, the paramedics, the speech therapists, the personal trainers, and lots more. BTEC Health and Social Care opens doors to careers in teaching and social work, nursery nurses and early years practitioners. Looks in the medical field, so we look at nurses, health visitors, midwives, physio and occupational therapy, speech and language, paramedics. It can lead you into youth and care work, and it might lead you into the actual management of those systems. So looking at clinics, the nursing homes, the care homes, the children's homes, the hospitals, and the people who run the behind the scenes jobs, not people that are frontline on the wards. If you're interested in any further information, it's in the Year 9 booklet. You can email me at school. You can speak with Mrs. Weimer, who usually works in DT, Digital Health and Social Care as well. There are some taster lessons to come. So hopefully in the summer term, when we're all back in school, we'll run some taster sessions and you can come up to 6th form and, you will be in D8 and you can come to talk to the young Mrs. Weimer, because in time there's likely to be a virtual parents' evening for Year 9. And we will be available as well if anybody wants to talk further about this subject. Thank you for listening, and I hope that's told you everything that you want to know. Goodbye.